So let's take a look at some examples of prefixes in each of these categories. So this slide may look familiar to you as well. I have organized some common prefixes based on each of these categories. You'll notice that there is a little bit of overlap. So some prefixes may relate to both location and direction, right? So kind of falling under the same category. If we think retro means backward or behind. So yes, directional, but directional and again location can sometimes be interchangeable or used in the similar context. So this is to say that certain prefixes may point to or be used in a directional sense, but it also gives us indication of location, such as retro, for example. Now, we will go through various examples, and they've been organized in the slide deck based on these categories just to highlight things a little bit more categorically, but again, just noting that there can be some overlap as we discussed for hypo, retro, another example. So we're going to begin with prefixes for location. So prefixes associated with body location may refer to areas within the body or outside the body. And as I mentioned, some prefixes have similar meanings, and we'll go through some that also have very similar spelling but still slightly different. And the way that they're used varies in context. So we'll discuss some more examples of this and how the context is specific in prefixes that have similar spelling. So here's an example of this. So we have the prefix ab and the prefix ad. So the prefix ab means away from or separation or movement away. And it's often used to describe movement away from a central point or origin. And an example of this is the movement of abduction. So abduction refers to moving a limb away from the midline of the body. So moving away from. Now, we can see a similar situation here where we have abduction and adduction, similar spelling, but different meaning. So in the case of adduction, this is the opposite. So ad refers to towards or near or in addition to, and it's often describing movement toward a structure or joining together, if you will. So adducting the arm, for example, is bringing the arm in toward the midline of the body, opposite of abduction. And a way to remember this is imagine the arm being added back to the midline of the body as a little way to remember that. So other examples on the slide here for ad, we see adrenal. So in this context of the word adrenal gland or the adrenals, this term specifically ends in AL, and AL as a suffix is pertaining to, and a location near the kidneys, if we break down this word further. So ad is our prefix at the beginning of adrenals, and then we see ren or reno is the combining form for kidneys, and AL is pertaining to, so pertaining to near the kidneys. The adrenal gland is a gland that sits atop the kidneys. So it's located right atop of the kidneys, and it is a endocrine tissue that will release hormones into the bloodstream, particularly associated with stress hormones. So we can see the use of this same prefix in slightly different contexts, but still holding that same meaning of near or towards for ad. So other examples in addition, so if we think of ab in addition to abduction, if you think abnormal, so the term abnormal means essentially deviating away from what is normal, right? So away from norm. And also for add, if we think of some other examples, adduction, adrenal, as we see here. Another one would be addition, so bring something towards or joining with something else. Adhesion, for example, adhesion means stick, so tissues sticking together is another example. So add is really common in anatomy to indicate, again, just in general, movement towards a central structure or location or attachment. Now, let's look at these two prefixes for location, endo and exo. These have essentially opposite meanings. So endo means within or inner, and exo means out. And a prime example of this is the difference between exocrine glands and endocrine glands. Now, exocrine glands, we'll start with exocrine. These glands secrete chemicals outside of the body. And an example of this is your sweat glands. So the sweat glands are found beneath the skin, and they are going to hold and produce secretions in the form of sweat in order to cool down the body. So these glands are stimulated to produce sweat when the body's homeostasis is challenged. So if under extreme exercise, for example, or being in extremely warm conditions, if the body gets too warm, one of the mechanisms that the body uses to reestablish homeostasis and reduce our body temperature is producing sweat. So the exocrine glands, exo because it's out, or the release of sweat from the body to the outside of the body, right? Now, endocrine glands secrete hormones within the body and into the bloodstream. We talked about the adrenals already. The adrenal gland is an example of an endocrine gland. So endo meaning within. And they're going to secrete hormones within the body into the blood. And another example of this is the pancreas. So the pancreas acts as an endocrine gland to secrete insulin into the bloodstream. So in response to increased blood sugar levels, insulin will be secreted from the pancreas into the blood in order to initiate the uptake of glucose from the bloodstream into our body's cells to be able to use that glucose as sugar for energy. So opposite meanings here, endo referring to within or inner, exo being out. Let's continue with prefixes for location. Now we're going to talk about ek, ex, and extra. Very similar, but have different contexts and slightly different meanings used in different contexts, and we'll talk about where they are most appropriately used. So for the first prefix, ek, meaning out or outside. Now, ek signals something external or sometimes displaced from its usual location. And the example that we'll use for ek is an ectopic pregnancy. So first, let's break down the word ectopic. Again, ek is referring to out or outside. Topic is referring to place or location. So ectopic literally means out of place. Now, in a normal pregnancy, a fertilized egg here will travel down the fallopian tube and to the uterus. And the uterus is designed to support and nourish a growing baby. We can see this very thick, stretchy muscle layer within the uterus, and also a very rich blood supply is present in the uterus to allow for development and provide nutrients to the growing fetus. Now, in an ectopic pregnancy, things look a little bit different. And so what happens in an ectopic pregnancy, shown on the right here, is that the fertilized egg actually implants outside of the uterus. So this can happen, we can see here of the fallopian tube, we can see that in this case, the egg has implanted into the interstitial space here of the essentially lining or wall of the uterus. And then here we can see an egg has implanted in the cervical region. So not within the uterus or in the thick walls of the uterus, but down here in the cervical region. So this is just showing the various locations that an ectopic pregnancy might occur, where implantation is occurring outside of its normal location. Now, the fallopian tube, as we can see here, is very small, and it's not built to stretch like the uterus. So, for example, if a pregnancy occurs here, the tube can tear or it can rupture. This can cause serious bleeding. Similarly, in the cervical region, again, this tissue, or even up here, the tissue is not designed to house and supply nutrients to a developing fetus. It's also not designed to withstand the pressures of a growing fetus as it develops. And so as a result, ectopic pregnancy is considered an emergency. So when you see this prefix ek here, remember it means something that's located outside or out of its typically normal place. And that can signal an issue. Now, X also refers to out, but also away from, outside as well. And it's similar to ek, and it's often used in general terms in anatomy. So some examples of X would be exhale, common, right? X means out, and hail refers to breathe, so breathe out. And here we have excision, or to excise something is to cut it out. So scission refers to cut out or remove, and X is out. So this particular prefix X frequently appears in procedures or an outward positioning, if you will. In medicine, for example, the outward movement of air. So again, movement, motion, procedures, and positioning is common for X in terms of general terms in anatomy. Ek, we more frequently see when something is, again, located out or outside of oftentimes its normal place. Now, as I mentioned as well, ek, or in that case for ectopic, outside or external is what we're referring to. Now, X is more out, away, or removal, if you will. So ectopic and ek is a little bit perhaps more about a location or away from a normal location, while X is more related to, especially in excision, removing or out an emotion, if you will, and so common in procedures. Now, finally, here we have extra, and extra refers to outside, and the example here is extravascular. Now, for extra specifically, we're more referring to outside of a given structure. So some examples of this might be extravascular, refers to outside of the vascular system. If we think extracellular, we're referring to outside of a cell. So yes, we have similarities in meaning for these given prefixes, but the context is slightly different in that X is more referring to out or, again, like a motion, a movement, or removal. Ek is referring to out, but outside of a typical location or a normal region typically. And extra is referring more to outside of or a surrounding space, if you will, such as, again, extravascular, extracellular. So for this example, we have used extravascular red blood cell destruction and the relevance of the spleen. So the spleen is sometimes not talked about as often as other abdominal organs. So I wanted to highlight extravascular red blood cell destruction. Now, again, extravascular red blood cell destruction. This is referring to the destruction of red blood cells that happens outside of the vascular system. So extravascular as a full term directly means pertaining to, outside the vascular system. Now, red blood cells normally travel inside of our blood vessels, right? Carrying oxygen to the body's tissues, and they typically live for about 120 days. So once a blood cell is specialized and becomes a red blood cell, it will have a lifespan of about 120 days. And after that, red blood cells become old or even damaged and perpetually need to be replaced. And so the removal or destruction of red blood cells happens mainly in the spleen. So here we're looking at the anterior view of an individual's torso. We can see the lungs right here. So this would be the left lung. This would be the right lung. We see the liver, right, the really large organ. So just over here at on the left side, if you will, of the liver here, in the upper left quadrant, we can see the spleen. Now, the spleen acts like a blood filter. So it actually will check red blood cells as they pass through the spleen. And if cells become too old or damaged, cells that are located within the spleen will break down those red blood cells that are no longer functioning properly or are worn out. So these specialized cells in the spleen are called macrophages. And we'll actually see macrophages when we talk about prefixes for size in a few slides from now. But macrophages are cells that exist within our immune system. So they're classified as an immune cell. And they are going to essentially take in red blood cells within the macrophage and break it down and essentially destroy these worn out red blood cells. This is really important because red blood cells are functioning as the carriers of oxygen throughout our body. And so we need blood cells that are functioning properly, that are able to bind iron effectively and bind oxygen and be able to circulate oxygen throughout our bloodstream and throughout the body. So because this breakdown happens outside of the blood vessels, it's happening in the spleen, it is called extravascular destruction. So again, extra means outside, beyond. So often is explaining outside or surrounding region, if you will. Again, extracellular, another example, or extravascular. So overall, for these three prefixes, a little tip could be to think of ek and ex as like out of either position or even movement or displacement, if you will. Whereas extra is more so referring to outside in a surrounding sense, if you will. So often describing a structure kind of outside of another position. Okay, and now we have epi. Epi refers to above or upon, and the example here is epidural. So an epidural, this term directly translates to, again, AL, pertaining to, upon, or above, if you will, the dura mater. So the dura mater, and we'll discuss this when we focus on the nervous system in an upcoming unit, but the dura mater we can see highlighted here, and it represents the very outer layer of the membranes that surround the brain and spinal cord. And these membranes are referred to as the meninges. Now here we can see this image showing an epidural needle here, and the needle is going to inject medication in the case of a spinal epidural for a patient who is in or near child labor, for example, injecting anesthetic medications into this epidural space. So into the space that is above or upon the dura, that membrane that surrounds the brain and spinal cord. injecting anesthetic medications here and at a particular level of the spine, and in this case we see between L3 and L4 vertebrae, injecting anesthetic medications here will stop feeling to the area of the body below that point. So in this case, it will help the patient to not feel pain during a natural delivery or during a C-section. They would have no feeling in their lower limbs. So again, epi referring to above or upon. Some other examples of the term epi would be epigastric, right? We saw when we were looking at the organization of the human body that the epigastric region is, and directly translates to epi, above, gastric, the stomach. So this is the abdominal region that is highlighting or designating above the stomach, if you will. And another term would be epidermis. So epidermis means upon or above the skin, right? Dermis. And so the epidermis is the most upper layer of the skin. Now let's look at in, inter, and intra. Again, slightly similar in their spelling, but the context varies, and also the where you would use each of these terms differs greatly. So let's talk about each. I'll start with in, actually, I will start at the beginning. So in refers to in or into, exactly. So incision is referring to cutting into something. So this will translate a little bit more directly here in terms of in, incision. Inter is referring to between. So between two structures. Intercellular is the example that I'm going to use, and this is helpful also with describing intra. So intercellular is referring to between two cells. So cells will often communicate with one another, especially neighboring cells. And so intercellular communication refers to any chemicals or cytokines, which are chemicals that may be released from one cell to communicate with another cell. So intercellular refers to between two cells. Intracellular, being that intra means within, intra means within a cell. So intracellular would be within an individual cell, intercellular between two cells. Intra can also be used in other contexts, such as for an intradermal injection. So again, intra meaning within or inside, dermal pertaining to the skin. So an intradermal injection is an injection into the layers of the skin rather than deep into the layers of the skin. An intradermal injection will happen just under the epidermis. So we can see that the needle in this case is placed not really perpendicular to the actual skin surface, but more parallel with this individual's arm. And it is being inserted at an angle to be able to inject the medication just below the skin surface, so just under the epidermis. Now, the reason for this is because the dermis is the layer that is below the epidermis. So the epidermis is the top layer, or the most superficial layer of the skin, and the dermis is just below that. The dermis has a bigger blood supply. The epidermis actually does not have a direct blood supply, but the dermis does. And even deeper to that is a fat layer called the hypodermis, which contains a lot of fat cells. And even below that would be muscle. Our muscle is located beneath all of the layers of the skin. So injecting medication just under the epidermis allows that medication to remain in that region for a longer time because it's not rapidly absorbed through the bloodstream. So this is commonly used in allergy testing, certain vaccinations even as well, but for allergy testing, we want the allergen to remain just below the skin to determine whether the skin will have an allergic reaction to it. So, therefore, intradermal injections are used when we want the substance to be placed just essentially within the skin, so just under the epidermis, to prevent it from being absorbed into the bloodstream quickly. Again, other examples, intracellular, within a cell. In this case, for intradermal, it's within the skin because it's between the epidermis and the dermis, so just below the top layer of the skin. Another one would be intravenous, right? So we know venous referring to a vein. So intravenous would be within a vein. So the key point here is that intra signals something that's happening inside of a structure or system. Inter would be between two structures or systems, and in is referring directly in as well, similar to intra, but used in different contexts, right? So for the case of incision, for example. Now let's look at para and peri. These are two prefixes that describe position or relationship to a structure in medical and anatomical terms. So para means beside, near, or along the side of, alongside. It's often used to describe something adjacent to a structure, or even in some cases of slightly deviating from normal. And so let's go over some examples of that. So we have on this particular slide the parathyroid. Now, parathyroid, para meaning beside, thyroid referring to the thyroid gland. And the parathyroid is the small glands that are located essentially beside the thyroid. So if we take a look at this photo here, this is the front view of the thyroid gland. So this is what's visible when you are staring at someone face on. And on the right here, this shows the back view. And on the back view, you can see these little highlighted orangey yellow circles. And that is the parathyroid glands. So these are the parathyroid glands, which are located essentially on the sides or along the side of the thyroid. Now, these smaller glands located on the posterior side and along the sides of the thyroid are involved in regulating calcium levels in the body and in the bloodstream. So again, the key point here, para often indicating beside, near, but it can also point to abnormal or deviation from normal. So an example of that would be the word paraplegia, which we talked about in a previous lecture. So para in this case meaning beside, and plegia meaning paralysis though. But in this case, para is referring to beside in an abnormal way. So paraplegia will refer to paralysis of the lower limbs, often from spinal cord injury. Now, one final example that I will give for para would be the paranasal sinuses. When you learn about the sinuses, those kind of empty cavities, if you will, that are in the skull that help to lighten the weight of the skull and are also involved in mucus production. So para means beside, nasal means nose. So the direct meaning is sinuses that are located beside the nasal cavity. So they're located within the actual skull itself. Now, peri means around or surrounding. Slightly different than para. As we saw, para is more so relating to beside or near or along the side of, whereas peri is surrounding or around. And we've seen before the use of the word pericardium, which is the fluid-filled fibrous sac that encloses or surrounds the heart and great vessels. And it's a very strong cavity, if you will, that is going to contain fluid that prevents friction as the heart is contracting. So peri, again, meaning around or surrounding. Cardi, specifically relating to the heart. So it's a sac that surrounds the heart. Other examples of peri is the peritoneum, which we've seen previously, right? So peri, again, meaning around. And the toneum of that word is referring to the abdominal cavity. So the peritoneum is that membrane that lines and surrounds the abdominal organs. So it lines the abdominal cavity. Okay, so again, para, beside or near, think adjacent. Peri, surrounding, more think encircling or enveloping. Now, a couple of more locational prefixes here. So sub and supra. So the prefix, I'll start with supra. The prefix supra means above or even over. So for example, the supraspinatus muscle in the shoulder sits above the spine of the scapula. Supra being above, spinatus, so S-P-I-N for spine of the spine of the scapula. So anything labeled with supra usually indicates that it's located higher, above, over another structure. On the other hand, sub means below or under. An example of that, in addition to, well, I'll go over the examples that are on the slide, but another example would be the subclavian artery. The subclavian artery runs below the clavicle, subclavian. Now, as a general kind of rule here, when you see supra or sub, we can kind of immediately think in terms of position, right, or location. Supra above, sub below. Now, on the slide here, we have a couple of examples. So for supra, in this case, suprapubic. So a suprapubic catheter is a catheter which is a flexible tube that is used to drain urine for the bladder. So it is inserted into the bladder, typically through a incision in the stomach region or in the abdomen. And this is done typically a few inches below the navel if an individual is unable to pass urine on their own. Then this catheter will allow for the draining of urine from the bladder into a bag that will be connected to the end of the catheter.